our headlines on this Thursday afternoon, July 28th. President Yoon partook in a Navy destroyer launching ceremony in the port city Ulsan on this Thursday. There, Yoon vowed to build a fortified defense posture at sea, on land and in air. Poland is poised to purchase hundreds of tanks and artillery, as well as dozens of fighter jets from South Korea to replace equipment donated to Ukraine to battle Russia's invasion. And the U.S. Federal Reserve has raised the federal funds rates by another 75 basis points as it seeks to curb inflation, which surged 9.1% on year in June. As widely anticipated, the U.S. Federal Reserve has raised its key interest rate by 0.75 of a percentage point, reaffirming its commitment to rein in soaring inflation, which accelerated 9.1% in June on year. My colleague Jeongjo has more on this latest decision and its broader implications.
The U.S. Federal Reserve raised its benchmark overnight interest rates by 0.75 of a percentage point for a second straight meeting. At the end of its two-day policy meeting on Wednesday, the Federal Open Market Committee announced its largest back-to-back rate increase. The adjustment brings the cumulative June to July raise to 150 basis points, which is the most aggressive tightening since 1981. The short-term borrowing rates now stand between 2.25% and 2.5%, similar to levels in 2019. The decision, despite risking a sharp hit to the economy, was unanimously agreed upon by voting members of the FOMC to crush inflation, which is running at rates unseen in 4 decades, reaching 9.1% in June.
Our overarching focus is using our tools to bring demand into better balance with supply in order to bring inflation back down to our 2% goal and to keep longer-term inflation expectations well anchored.
Powell said that this process is likely to involve a period of below-trend economic growth and some softening in labor market conditions, but added he does not think the U.S. economy is currently in a recession.
There are just too many areas of the economy that are performing, too well. And of course, I would point to the labor market in particular. As I mentioned, it's true that growth is slowing. And for reasons that we understand, really the growth was extraordinarily high last year, 5.5%. We would have expected growth to slow.
He also signaled a possible third hike, saying the Fed anticipates that ongoing increases in the target range will be appropriate. But one expert says it's unlikely that interest rate increases will be as big as the last 2 rate hikes.
I think it's more likely that we're going to see some better numbers for headline inflation because energy prices in the U.S. have come down a bit and some food prices have come down. Probably what will happen in September will most likely be 50 basis points.
The Fed's aggressive monetary tightening also has global repercussions. The U.S. interest rates have surpassed those of South Korea for the first time in 2.5 years, which could lead to capital outflows from South Korea. But Seoul's finance minister says the effect of the Fed's rate hike on local financial markets is likely to be limited.
In the past, there were 3 times that the Fed's benchmark interest rates have gone above South Korea's, but during those rate increases by the Fed, foreign stock investments maintained net inflows.
Chu added that the government will closely monitor the situation and expend preemptive measures against any risks. Jeong, Arirang News.
Here on the local front, President Yoon took part in a Navy destroyer christening and launching ceremony in the port city of Ulsan on this Thursday. Now, there Yoon vowed to build a fortified defense posture at sea to allow for broader economic security. Do take a listen.
바다에서 우리 스스로를 지키는 해양 강국의 역량을 갖춰야만 경제 강국이 될 수 있습니다. 국민들께서 바다에서 안전하게 경제 활동을 펼칠 수 있도록 강력한 해양 안보를 구축할 것입니다.
Jeongjo The Great, named after Joseon Dynasty monarch King Jeongjo, is a national strategic asset and a core part of the Korea air and missile defense system against North Korea's missile and nuclear programs. Now, it's South Korea's first 8,200-ton Aegis destroyer, built entirely with homegrown technology, and will be delivered to the Navy in the year 2024 for actual use. And South Korea has reportedly reached a massive arms sales deal with Poland. The deal includes Fa-50 fighter jets and K-2 armored tanks that are all being shipped from South Korea to a NATO country for the first time. According to the Korea Aerospace Industries on this Thursday, Poland is poised to purchase 84 of its Fa-50 light combat aircraft at a cost of some $3 billion. Also, Hyundai Rotem, the producer of K-2 Black Panther tanks, says its deal, that is, with Poland, will see the export of 1,000 armored vehicles. Hanwha Defense, meanwhile, is selling about 650 of its KF, that is, K9, that would be, self-propelled howitzers to Poland. Over in Washington, D.C., there has been a new symbolic addition to the Korean War Memorial there, a granite wall of remembrance, hosting the names of 43,000 service members who surrendered their lives during the war here on the Korean Peninsula. Our Kim Hyo-sun has more.
A new Korean War monument with the names of fallen heroes inscribed upon it was unveiled in Washington on Wednesday. The dedication of the Wall of Remembrance was marked by a ceremony that brought together some 3,000 people, including government officials, Korean War veterans, as well as their families from both South Korea and the U.S. The wall bears the names of over 43,000 service members from South Korea and America who were killed during the war. During the ceremony, a message from South Korean President Yoon was read by Minister of Veterans Affairs Bang Min-sik on his behalf.
Korean War veterans, you are the guardians of freedom and true heroes who protected the Republic of Korea.
The message stressed that the new monument represents the solidarity of the ROK-US alliance, adding that the sacrifices of the fallen heroes will be forever remembered. Second Gentleman Doug Emhoff joined the ceremony on behalf of President Joe Biden, who was diagnosed with COVID-19 late last week.
It's a poignant reminder of the individual sacrifices of the more than 36,000 U.S. service members and the more than 7,000 Korean troops who served together and died together in Korea.
Family members of Korean War veterans were also in Washington to see the names of their relatives.
They always called the Korean War the Forgotten War, and I think this helps to dispel some of that.
The construction of the wall cost $22 million and was funded by donations from Korean and American organizations and private donors. Building began in March 2021, with the wall officially unveiled during Wednesday's dedication ceremony. Kim Hyo-sun, Arirang News.
Now, as history books reveal, South and North Korea are technically still at war, as their 1950s violent confrontation ended with an armistice and not a peace treaty. Accordingly, this reality stands as the backdrop of painful stories of separation even today. Our Kim Yeon-sung explains.
69 years ago, the war-torn peninsula came to an agreement to put the war on pause and to cease all hostilities. But that peace meant separation, for the North and South remained divided along the Korean demarcation line with no promise of when the war would finally end. And that peace brought pain for families split between North and South. 86-year-old Chang Chun-hee comes from Pyongan-namdo province in North Korea.
전쟁이 없었다면 아버지하고 오빠하고 정말 행복하게 살았겠죠. 전쟁이 없었다면.
In the frenzy of the Korean War, she lost touch with her family, but for years she held on to the same hope.
저는 항상 저의 아버지를 만날 수 있을 거다는 그 희망을 갖고 살았어요. 김포공항에서 만나는 그런 상상을 늘 하면서 소설 속의 주인공이 됐어요, 항상. 꼭 만날 거라는 그런 기대를 가지고 여태까지 살았던 거예요.
Chang Chun-hee still keeps decades-old letters, articles, and pictures that show a glimpse of her father's life. There are thousands of tragic stories like hers. More than 133,000 people in South Korea are registered as a member of a separated family. More than 2/3 of them have passed away. Heo Young-chul defected to South Korea 20 years ago. Here, he settled down to a new life as a film director. He says that he had no other choice but to escape North Korea in order to live. But he lives with the pain of leaving his family behind.
보고 싶은 마음은 간절한데 하도 간절하니까 그래서 내 마비가 온 것 같아.
According to Korea Hana Foundation, the biggest reason that defectors are unhappy with their lives here is because they have to live apart from their families. Director Heo Young-chul is currently developing a virtual reality program where separated families can once again meet their loved ones in the north.
정말 몇십 년 동안 못 보잖아. 앞으로도 영원히 못 볼 수 있어. 그러면 그들이 사진 한 쪽이라도 가져오면 우리가 그걸 재현해서 가상 프로그램에서 만들 수 있는 이런 것도 좀 하려고 하거든요.
The war was put on hold 69 years ago, but the pain still ripples through the decades. Kim Jung-un, Arirang News.
Across the border in North Korea, Kim Jung-un reportedly made his first public appearance in almost 3 weeks on Wednesday to commemorate the 69th anniversary of the Korean War armistice. According to the state-run Korea Central News Agency Thursday, Kim visited the Fatherland Liberation War Martyrs Cemetery in Pyongyang to pay tribute to soldiers killed during that war. The report also said Kim met veterans at the monument to the victorious Fatherland Liberation War. The latest public outing was the first time Kim had been seen in 19 days since a photo session with ruling party officials earlier this month. Meanwhile, discussions over regional security continue between the Yoon and Biden administrations as the threat of North Korea's nuclear ambitions persists. Now, that being said, our Foreign Ministry correspondent Min Soo-kyun has details from that latest exchange here in capital Seoul.
The U.S. Undersecretary of State for Political Affairs Victoria Nuland, who now is in Seoul, met with First Vice Foreign Minister Cho Hyun-dong on Wednesday. The two discussed a wide range of issues, including the security situation on the Korean peninsula. Both sides shared the view that North Korea's nuclear missile threats remain an urgent task that needs to be dealt with. With that in mind, they agreed to keep the door open for dialogue with Pyongyang and carry out a flexible approach in their diplomacy with the regime. But in the event of a North Korean provocation, they plan to work closely to ensure a strong, unified response from the international community. On the Seoul-Washington alliance, Cho and Nuland hope to swiftly hold their extended deterrence dialogue and agree to work on what they call their new Global Comprehensive Strategic Alliance. The two sides also agreed to expand cooperation on key issues such as global supply chains and climate change. Later in the day, Nuland also met with Seoul's top nuclear envoy, Kim Jung-un, to discuss plans for North Korea's denuclearization. At their meeting, the two are expected to have discussed South Korea's bold plans, which includes economic incentives in line with North's efforts to denuclearize. The senior U.S. diplomat arrived in Seoul on Tuesday for a 3-day trip after shortly visiting Tokyo early this week. Min Soo-kyun, Arirang News.
And on that note, we end part 1 of the Daily Report. In part 2, we address the rampant resurgence of COVID-19 here and elsewhere. Stay with us.
South Korea's experience in tackling COVID-19 and introduced a Korean survivor of Japan's wartime slavery met with
extraordinary climate crisis and pledged to work with the EU to tackle the challenge.
The objective of its North Korea policy is
protesters gathering across the country to peacefully demand an end to hate and violence.
Arirang, what matters?
feel so good right now. Maybe I had a drink or two, but this somehow feels like it's forever. All my friends are here having fun and feeling good right now. Maybe this is forever. All my friends are here having fun and feeling good right now. Forever.
Welcome back. Quite a number of countries are battling rapid rebounds in COVID-19 caseloads, including South Korea. On Viewpoint today, we assess the current situation and explore the options available to better address this latest wave. For more, I have Professor Howard Lee from Seoul National University. Professor Lee, welcome back.
Good afternoon.
I also have Professor Peter Chin-hong at the University of California, San Francisco, live on the line. Professor Chin-hong, it's a pleasure to speak with you again.
Same here, Sunny. Thanks for having me on.
Right, Professor Lee, South Korea's daily tally has soared to levels last seen over 3 months ago. How high do you expect caseloads to rise before they begin to retreat?
It looks like we're riding a new tide in the COVID-19 battle in South Korea. The daily new cases, number of new daily cases has just exceeded 100,000. Likewise, the number of hospitalized patients is on the rise. Based on the previous resurgent experiences, it looks like we are expect to see more cases, more significant in more significant numbers in the next month. Again, based on the past experience, I think the number can go as high as more than 400,000 a day. This expectation is based on two facts. Number one, the BA.5 has been dominating the virus population recently in Korea. And number two, the BA.5 is by far the most contagious subvariant we have ever seen.
Right, I see. And Professor Chin-hong, the U.S. is also reliving through a resurgence. And that being said, what can you tell us about transmissions there and the tallies with regard to critical cases and the fatality rate?
Well, Sunny, the U.S. is seeing amongst the highest levels of community transmission that we've ever seen in the pandemic. Although there are only officially 100,000 or so, 130,000 cases a day in the U.S., most people are doing testing at home, and some people are not even testing anymore or getting false negatives in the beginning. At the same time, our hospitalizations are going up a little bit, about 30%, but nothing compared to where we were in January. and deaths are still around 400 a day, but again, very different from, say, December when we were more than 2,000 a day. So some good, some bad, lots of transmission. And when you look at the wastewater epidemiology, it's definitely amongst the highest we've ever seen.
Right, I see. And Professor Lee, how do you assess South Korea's tallies with regard to severity as well as fatality? And for the sake of comparison, how do they compare with the figures we saw during our previous wave?
As the number of new daily cases has been on the rise, we are starting to see more and more severe cases. For example, daily severe cases yesterday was 177, which almost doubled the number a week before. But when it comes to case fatality, it has been under 0.1% since March, which also shows a decreasing trend. I think a couple of explanations are possible. Number one, many people have been vaccinated. Vaccines are still effective in getting symptoms milder and shorter, although it may fail in protecting you from getting infected. And yeah, so my short answer to your question is that we don't need to get panicked at this point about the resurgence
right, so
recently.
We don't need to be that worried.
No, I don't think so.
Yeah. Right. Professor Chin-hung, health authorities in the US have recently endorsed, recommended that is, Novavax's COVID-19 vaccine for adults aged 18 and above. I understand Novavax uses a technology that is quite familiar. Could you tell us a bit more?
Yes, definitely. So it's the fourth vaccine approved in the U.S. It took some time for the U.S. Because it's been approved in so many countries around the world. It uses a more traditional technology, which is based on what's called a protein subunit vaccine. So in the mRNA vaccine, everyone knows you put the code to the spike protein on a fatty bubble, and you deliver it to the cell. The cell then makes the spike protein, and then antibodies develop. In the Novavax technology, like hepatitis and human papillomavirus vaccines, you chop up the protein beforehand, so you don't send the code. It's a more later step. The protein then gets delivered to the cells, and the antibodies are developed after the immune system sees the foreign invader. So much later process, more traditional, but a very good vaccine.
Right, and staying with that then, Professor Chin-hung, do you see this reality, the fact that Novavax's COVID-19 vaccine uses a familiar, a more traditional vaccine technology, do you see that as perhaps boosting vaccine uptake over there in the US?
Unfortunately, I don't think it will move the needle too much. And even if you look at the orders for the vaccine from the Biden administration, there are only about 3 million that they ordered. And there are about, anywhere from 25 to 50 million Americans who still haven't been vaccinated. So even the Biden administration is acknowledging that not everybody will jump on board. I think Novavax is probably going to be best as an extra vaccine for the world. It's already being produced generically in India, and it may have a little bit of uptake in the US from that unwilling group, but probably not moving the needle very much.
Right, I see. Professor Lee, you mentioned the BA.5 strain, and there is talk about this particular strain making patients test positive longer, despite the fact that the duration of symptoms is shorter. How do you explain this finding, and does this mean that the patient is still perhaps contagious?
I understand many share that experience. The ultra contagious BA.5 Omicron subvariant, it could make people test positive longer while the symptoms are milder and shorter. That may be because people have been vaccinated already, as I mentioned earlier. So in the case of the longer test positive, what should we do? The CDC, US CDC has not provided any specific guidance in that situation, but many experts in this field assert that once you are free of symptoms and have been isolated for five days, you don't need to extend isolation any longer.
Right. And Professor Chin-hung, there is also talk about the incubation period of BA.5, as Professor Lee has mentioned, being shorter. Is this an accurate assessment based on what you've been hearing there in the US?
Yes. In the original ancestral strain, it was probably on average around 5 days or 6 days. in Delta, it was probably around 4 days, and what we're seeing in Omicron, and particularly in BA.5, is incubation as short as 3 days. So incubation is the time the virus starts from your body, it's in your body, to when you develop symptoms. And as Professor Lee states, it's probably due to a bunch of factors. Part is the virus probably making more in BA.5 per cell, but also part is the fact that many people are immunized already and have some antibodies circulating. So they see the enemy. They don't have to wait for a lot of enemy to be there before you get sick, because your immune system activating makes you sick. And then until that those cells build up or the virus builds up. So you're getting sicker earlier because the immune system is more primed to see the enemy.
And staying with subvariants, Professor Lee, authorities here in South Korea have confirmed at least 4 cases of the Omicron subvariant BA.2.75. What can you tell us about this particular strain?
The BA.2.75 is a very interesting species. It was first identified in India, followed by in approximately 10 other countries, including South Korea. It is basically it is a child variant of BA.2, and also has been reported to have many more mutations, particularly at the receptor binding domain, which is a key part for the virus to enter human cells. BA.2.75 has been unofficially named the Centaurus after a Greek mythological creature, Centaur. But according to the WHO has not given any official name to BA.2.75, probably because there are not much data, sequence data available yet to judge if this is a subvariant enough to be given a specific name. And that's why BA.2.75 has given another nickname, which is scariant. But according to WHO, again, the BA.2.75 is a subvariant of interest, but not of concern yet. More data will tell us if this is something that we really need to worry about. But not at this point. No, I don't think it's going to. It's not a big concern for us.
Right. So it's still evolving then.
That's true.
Professor Jeongjo, what efforts are being made now there in the U.S. to better contain this latest rebound in COVID-19 cases?
Well, I think right now, even despite having a very comprehensive endemic plan, so to speak, a few months ago, the Biden administration is really focusing on 2 things right now. Vaccines, of course, but vaccination rate has really slowed in the U.S., even in the under 5 group where it was recently approved. So the other focus is on Paxlovid. So they're trying to make sure a lot of people who are eligible get Paxlovid as soon as possible, because it's going to prevent people from being hospitalized. So the ways that they're trying to achieve this, apart from publicizing it more, is by allowing pharmacists to be able to prescribe this. This was done a few weeks ago in the U.S., and it's hoped that this will allow people in more rural areas, in poorer areas, to have access faster to Paxlovid. So that's the focus right now. It's being limited because the $10 billion is being held up in the Congress now in the U.S., hasn't been approved. We need money to continue to have all of these initiatives, particularly with the new vaccine in the fall, the new booster that we're planning.
Right. Professor Lee, here in South Korea, authorities have spoken against, that is, reinstating social restrictions, but they have shared recommendations for high-risk facilities. Mm-hmm. What would you care to add with regard to containment efforts here in the country? The so-called quote-unquote voluntary social distancing policy decision made by government is primarily based, I think, based on the results of a recent survey where 60% of respondents were not in favor of the past strict measures. They don't simply want to go back to the past. Having said that, however, I think it is quite important to recover test capabilities back again in South Korea, because there are so many undetected cases hiding in the community.
in order for that can be possible, and I think it's very important to lift the barriers, access barriers. In other words, it is very important to make the test, particularly PCR test, available free of charge again, and that way we can make more people to come to the clinic or some other places to get to have them tested. At the same time, I recommend wear a face mask outdoors, even though it's not a current mandate.
Right, because at the moment face masks are mandated indoors.
Indoors, right. Yeah.
Professor Chin-hong, there appears to be no end in sight with regard to this pandemic, but can we expect the severity of the symptoms caused by its variants perhaps to fall in the course of time?
Yes, Sunny. I think we think about two things when we think about what's going to happen. If you think about the virus itself, when you talk to virologists, they say there's no rhyme or reason why the virus will continue to get less severe. In fact, we realized from the case in Hong Kong that even something as innocent as Omicron, if it falls into the wrong soil, like an unvaccinated older population, it can still cause a lot of deaths. So rather you think about the soil, which is the population is getting more and more immune. And over time, deaths are falling. They're still too high in the US. It's double probably what normal bad flu season. And we need to address that before we accept it. But people are getting very, very tired right now. There are people who are going to get very, very sick, who are unvaccinated and unboosted if you're older, immune compromised. But there are a lot of people who have now experienced COVID themselves. They're not fearful of it anymore. They're not taking any precautions. And, that is worrisome for the future.
Right, it is. And speaking about vaccinations that was mentioned by Professor Chin-hong, Professor Lee, what are your thoughts on expanding the vaccination campaign here in South Korea to younger children, as is the case over in the US?
Right. Currently, the vaccination rate in the younger population, younger than 19, for example, particularly younger than 10, is very, very low. So, parents are not quite into having their children vaccinated in South Korea. So I think it's very important to encourage them to bring their children to the clinic for vaccination, because vaccination helps, although it may not 100% sufficient enough for them to help, protect people from getting infected, but it will decrease the likelihood of getting severe, hospitalized, even death. So vaccination, particularly in the younger population in South Korea, is getting more and more important.
Right, it is. And Professor Chin-hong, our Professor Lee here in the studio talked about the importance of face masks. What are the prospects, perhaps, of face masks being reinstated there in the US, do you think? Especially indoors.
Well, I think it's going to be very unlikely for face masks to be reinstituted as a mandate. However, there are very, very strong recommendations. And, LA had threatened to bring it back if the hospitalizations continue to increase. So far, they are kind of stable, so it's probably not going to come back. They tried it in an area in Northern California. It didn't really work for very long. But you're going to see it still in very micro environments. So in the hospital where I work, never went away because our patients are too vulnerable. You're still seeing it in nursing homes and prisons. And in schools, it may come back at some point if there's so much virus around that education gets disrupted. So micro environments, but probably never again on a societal level, because it's not very popular in the population anymore.
Right. And Professor Lee, I was wondering here, the administration has spoken about the need to adopt a scientific approach to dealing with COVID-19, meaning that, as I mentioned earlier, social restrictions will not be implemented any longer. Speaking within your capacity as a doctor, however, what are your thoughts on reinstating perhaps such social restrictions?
I don't think that will fly. They will take off in South Korea, because people have already experienced the feeling, the pleasure of being free. So they don't simply want to go back to the past. And once they, since they have once experienced that kind of feeling, they are more likely to be resistant whatever measures the government will bring up.
Right, there is a very strong sense of fatigue.
Scientific does not necessarily mean that it has to be natural science. Science based only on natural science. It also science based on human psychology, society, and everything, culture and everything. That also involves when we call something scientific, we also entail those kind of aspects too.
Right, I would have to agree.
Yeah.
All right, Professor Lee, as always, thank you very much for your insights. And Professor Chin Hong over in the US, thank you very much for your time and for your thoughts.
Thank you.
Thank you.
The biohealth industry looks to become a strategic sector. During his latest weekly emergency economic meeting, President Yoon Suk-yeol took time to highlight the gains to be garnered from this fresh initiative. Our presidential office correspondent Yoon Jung-min reports.
South Korea will nurture its biohealth sector to develop it into one of the nation's core strategic industries. That's President Yoon Suk-yeol as he toured the Healthcare Innovation Park at Seoul National University Pundang Hospital just south of Seoul on Wednesday.
정부는 바이오 헬스 산업을 국가 핵심 전략 산업으로 육성할 계획을 가지고 있습니다. K-바이오 백신 펀드를 조성하는 등 금융 지원 역시 확대해서 기업들이 블록버스터 신약과 백신 개발에 전념할 수 있도록 지원하겠습니다.
That will require cutting red tape to speed up approvals for AI-applied and digitally innovative medical devices.
바이오 헬스 분야의 신산업 영역의 규제 혁신 방향을 우선 제시해서 시장에서 예측 가능성을 높이고 혁신적인 기술이 상용화될 수 있도록 지원하겠습니다.
The president's top economic aide said Yoon called for the need of biohealth clusters similar to the biotech hub in the greater Boston area.
The government plans to focus on fostering biohealth infrastructure, including regulatory innovation, raising manpower, and supporting R&D. We will provide support in finance, tax, location, and licensing to ensure private investment worth 13 trillion Korean won implemented as planned.
Greater Boston is home to more than 1,000 biotechnology companies ranging from small startups to billion-dollar pharmaceutical firms, and its proximity to leading academic institutions give the region a large network of scientists and access to generous public and private funding. Yoon Jung-min, Arirang News.
In other news, Indonesian President Joko Widodo met with South Korean business leaders at a hotel here in Seoul earlier on this Thursday morning as part of his two-day trip to the country. Relevant officials from the two countries also held talks afterwards to further advance or address ways to advance the joint efforts on digitalization and energy. Widodo was also scheduled to make a stop at a Hyundai Motor Research Center but had to cancel due to his tight schedule. Later on this Thursday, the Indonesian leader will meet with President Yoon Suk-yeol. Among the issues during the summit is that related to Indonesia shouldering its share of the expenses involved in the development of the KF-21 fighter jet. On the corporate front, Samsung Electronics has recorded its highest ever second quarter sales. The company on Thursday reported sales of some $59 billion, up about 21% compared to the year before, marking the second biggest gain for any quarter. Operating profits for the same period jumped more than 12% on year to $10.8 billion. Pundits are linking these strong sales to chips and displays. Meanwhile, South Korea's demographic portrait continues to raise much concern. The month of May saw fewer bundles of blessings, if you will, and more losses of lives. Arirang has more on the implications of the country's declining population.
It seems demographic challenges here in South Korea are still unsettled. A report released by Statistics Korea on Wednesday shows that there were 20,007 newborns in May, down 8.8% from a year earlier. It marked the lowest figure for any May since relevant data was first compiled in 1981 and is also the lowest figure in 74 months. and it's also the 78th consecutive month of on-year decline. This comes as the number of women in their 20s and 30s, the average age at which women give birth in South Korea, is decreasing. Meanwhile, the number of deaths increased by 12.8% on year to 28,859, also the highest for any month of May. A spokesperson for Statistics Korea said the latest figures are largely due to an increase in the number of older people in the country.
Clearly, as the number of older people increases, this is contributing to a rise in the number of deaths. And just like it was back in March and April, COVID-19 is a threat to older people and leads to a high death rate.
The number of deaths has been exceeding births for 31 consecutive months now. One expert says there should be different approaches to deal with this matter.
Even though the policies have not been very successful in the past, we should still try having more daycare centers, more places where parents can safely put their kids during working hours so parents can go and find and do work. And secondly, the Korean approach has been to try to protect the jobs of women who take time off to have babies. I'm not sure if this is a good strategy. I think that keeps firms from hiring qualified female workers. So instead of the traditional approach of protecting women, having a more flexible labor market may actually be better for pregnant female workers.
Meanwhile, the number of marriages rose 5.5% in May compared to the same period last year, the figure standing at 17,041. Analysts say this is due to weddings that had previously been postponed because of COVID-19. However, the official says the number of weddings in May is still the second lowest number since data was first compiled. Lee Dae-hyun, Arirang News.
A local research team is looking to make effective use of electric scooters here in Seoul to assess pollution levels as well as road safety and even to detect urban disasters. Our Jeongjo explains.
Over 1 million people in South Korea use shared electric scooters. They allow users to move short distances while avoiding traffic jams. There are more than 50,000 of them in Seoul alone, and because they have no fixed return location, they can be found almost anywhere. A South Korean research team has developed a type of technology that collects environmental data using those electric scooters. As the rider moves forward, the surrounding area's temperature, humidity, atmospheric pressure, fine dust levels, and ground conditions are recorded once every second. The data is then transmitted in real time to a server so it can be viewed in graphs and maps. This map shows that only certain alleyways have high ground temperatures, which is indicative of an urban heat island, an area that's become warmer due to human activities. Fine dust levels around the building are also bad, but are much lower once you leave the building's vicinity.
I felt it was necessary to inform people about how fine dust levels change at construction sites when it's windy.
Data collected by scooters can also help detect urban disasters before they occur. The same research team spotted black ice on the road by combining information on the road's bumps with the ground temperature. By combining information on ground temperature and vibrations, the research team hopes to be able to detect potential sinkholes or sewage ruptures before they happen.
This technology allows us to store basic data that can be analyzed in various ways. The combination of the sensors can change depending on the purpose of its use.
The sensor used to gather information currently weighs 1 kilogram, including the battery, and can last for up to 4 days on a full charge. The research team plans to look at ways to reduce the weight of the sensor and conduct large-scale tests in a smart city located in Busan starting from the second half of next year. Jeongjo, Arirang News.
Let's take a look at what's going on in the world now. New monkeypox infection figures have been announced by the World Health Organization. The total number of cases in the monkeypox outbreak has now reached 18,000. The Director General of the WHO, Tedros Adhanom Ghebreyesus, said on Wednesday that the cases had been seen across 78 countries. He said 5 deaths from the disease were recorded in Africa, while 10% of all cases result in hospital admission. The WHO also said that 98% of cases outside of Africa were reported in men who have sex with men. But the WHO had also warned against the danger of stigma and discrimination and said that anyone exposed can be infected. Europe is seeing the lion's share of cases at 70%, while the Americas account for 25%. The WHO has recommended vaccination for high-risk groups. In a bid to bring home a women's basketball star and a former Marine, the U.S. has offered a deal to Russia. U.S. Secretary of State Antony Blinken said on Wednesday that, quote, a substantial proposal to Moscow was made weeks ago for WNBA star Brittany Griner and ex-Marine Paul Whelan. Blinken added that he expects to discuss the deal with his Kremlin counterpart Sergei Lavrov this week. It will be the first conversation between the ministers since Russia invaded Ukraine. The potential deal signals a policy reverse for the U.S., as the Justice Department usually opposes prisoner trades. The Biden administration has reportedly offered to exchange Victor Bout, a convicted Russian arms trafficker, as part of a potential exchange deal. Iraq's parliamentary building was breached on Wednesday by hundreds of demonstrators protesting the nomination of a new prime minister. Supporters of populist Shia leader Muqtada al-Sadr stormed the building following the nomination of Mohammed Shia al-Sudan by the Shiite Coordination Framework, a pro-Iran alliance. The nomination came as al-Sadr's parliamentary bloc resigned en masse last month in the wake of an extended political stalemate. As of Wednesday, Iraq had entered a record of 290 days without a head of state or cabinet since elections last October, mainly owing to infighting between Shiite and Kurdish lawmaker groups. Political uncertainty has left Iraq without a budget for 2022, hampering spending on essential infrastructure projects. A large 170-carat pink diamond has been discovered in Angola. Dubbed Lula Rose, the rose-colored diamond is believed to be the largest gemstone of its kind found in some 300 years. The gem was found at the Lula Alluvial Diamond Mine, according to mine owner Lucapa Diamond Company on Wednesday. The mine itself is a hotbed for large gemstones, producing 2 of the largest diamonds ever found in Angola. Among the 27 diamonds over 100 carats found at the mine, Lula Rose is the 5th largest. Pink diamonds are rare, occurring once in every 10,000 diamonds. Matthew Ashley, Arirang News.
Good Thursday afternoon. There's very little relief even at night now that we're in the dog days of summer. The capital is baking hot, reaching 33 degrees. In this weather, heat-related illnesses are known as a silent killer, so knowing the signs and how to deal with them can save your life. And most of the country is sizzling like a rump of roast on a hot bed of coals, with heat warnings in Jeollado and Chungcheongnam-do provinces. Also, factor in a high UV index and ozone levels if you're heading out today. Well, skies are going to be partly cloudy at times, but be ready for showers later today. Parts of Gangwon-do, Chungcheongnam-do, and Gyeongsang-do provinces are expecting 5 to 40 millimeters of rain. So stay safe as showers could be followed by lightning or gust. And tomorrow, a scorcher with scattered showers is forecast, but be aware of Typhoon Songja, which could produce some rain on the south coast and Jeju Island. Conditions could be quite changeable, so stay weather aware. Now, let's take a look at the worldwide weather conditions.
And that is all the time we have for this edition of the Daily Report. Do stay tuned to Arirang News for more on the headlines. Thank you for now.